taking Tylenol is not good. All right, I'll say it. It's not good.
Big moment last week when President Donald Trump announced that the FDA will soon tell physicians that the use of acetaminophen, that's the active ingredient in Tylenol, during pregnancy can be associated with an increased risk of autism in children. This morning, we wanted to have a conversation about that with our chief medical correspondent, Dr. Hebert, about the president's comments, also the findings of studies on the causes of autism, because there's a lot to break down here.
Yeah, and I really want people to, you're going to read your specifics from your phone, and we know that, all your little research you're going to do. But I want people to think about this just a little more globally, okay? Let's take it back to you, all right? The reason why it's so hard to link autism with Tylenol is because think about what's happening when a pregnant woman takes Tylenol. What's happening? She's stressed out. She is having a fever or having a lot of pain. She may have eaten something that day that may have caused some issue. There's so many variables. So when you put all that stuff together to say that autism is caused by just the Tylenol that she took, how can you prove that? How can you prove that? You can't. And the only study that we have, it was out of Sweden, and basically what it showed is that it looked at 2.5 million children, the women that had, that were having a baby, that were pregnant, they had children, and then they had siblings. Okay, so the woman had 2 different pregnancies. They controlled for all of those things, meaning they knew what medicine she took. They knew all the things she ate. They knew everything. And then they looked at the results, and the results showed that there was no direct link to autism when the person took Tylenol. So that's the clearest way I can take it. So Brendan, you got to understand, when you're looking at a person and they're pregnant, so many things happen.
Sure.
You could go to the store and drink 4 Coca-Colas. You can do all kinds of things right before you have a fever. And so you can't just link it to one thing. And if you try to do it, you got to control for it. You can't just say, well, she took Tylenol and then the child had autism, and now that's the reason.
And it seems also the many different reasons why one would use Tylenol, depending on what the ailment is, potentially what risk we run into by not treating that and what the fetus may get as a result of not paying attention to it.
Right, so we know for sure that if you have a high fever, right, and you are pregnant, that your child can suffer serious birth defects and birth issues if you do not take something to decrease that fever. So high fever during pregnancy is definitely a risk for autism, but Tylenol at this point, we cannot say if it is or if it isn't. And I do want to say this too. The president did say, talk to your doctor, make your own decision. They're not taking Tylenol off the market. Talk to your doctor and you make that decision for yourself. And that is the freedom that we have in this country to do so.
Looking at some other health headlines here, cocoa extract slowing the aging process here.
Yeah, now I'm glad we're talking about this one because I'm always telling you what you can't take. I'm always telling you what you can't do. So we looked at a lot of people in this study. I want to quote this study. It's the Cocoa Supplement Multivitamin Outcome Study.
Say that 10 times fast.
That's right? And basically it's people that took cocoa. They were 70 years old. They looked at 600 people, and they took cocoa extract every day. And the folks that took the cocoa extract, now I'm not saying just go eat a bunch of chocolate bars, okay? I'm talking about cocoa extract, which you can buy. They had a 27% decrease in heart disease. Okay, and they had a decrease in their C-reactive protein, which is an inflammatory marker in the body. So this whole concept of age-flammation is what is the new term, because basically as you get older you get more inflammation. Inflammation causes all of these chronic illnesses. So if we can say if you take cocoa extract, you will decrease your CRP, which is the marker for inflammation. You can decrease your risk of heart disease, which comes basically from inflammation. Then cocoa extract is probably one of the good things. So now that I've told you what you can't do all these years, go get some cocoa extract, man, and you'll be
probably
all right.
some cacao nibs or whatever in your smoothies. That's probably really good. Those antioxidants this down. And we're out of time, but real quick, more kids getting flu-related encephalitis. That's a big
yes,
one.
and it's a big one. So people are not taking their flu shots, so more children are getting the flu. Okay, last year was the worst flu outbreak since 2009. Not a lot of people got it, but it was still more. So just really quickly, if the child gets the flu, and then the child starts having lethargy and feel like they can't move their limbs and really bad headache, they could have something that is called encephalitis. And if they have encephalitis, that's a medical emergency. Please, if your child has the flu, bring them to the hospital because it can be very serious and also fatal.
All right, Chief Medical Correspondent Dr. Corey Hebert, sporting some new jewelry here too.
Oh,
Congratulations
thank
to you, sir.
very much.
Congratulations on the wedding. Good to have you back.
Thank you very much. Glad to be back. I mean, look, I leave and man, it seems like the world went a little
that
crazy.
means
I won't be leaving again.
Well, you know that thing about causation, as you all like to say.
There you